Hi, everybody. Happy holidays. This is Lisa Grunebaum, and today we're going to talk about facelifts, myths, and realities. I want to start by thanking you for coming on this facelift journey and also mention that I've noticed almost like an uptick in the past couple weeks, maybe couple months of confusion out there about facelifts, mostly on social media. And I really encourage you to ask questions in the chat. So if you have questions, I'll definitely come back to them. So I didn't include much by way of patient photos in this particular presentation, which I'll explain in the next slide. But I really preferred if you do not take pictures of my slides at all. If you need anything from me, you can contact me at the office. And certainly, please do look at my Instagram and you'll learn more about me and about facelifting. So to that end, I did not include before and afters of my own work. They are available on my Instagram. And I did that on purpose because my purpose with you all today is to educate, not to make a commercial for myself. And I think at Clear Dermatology, our mission really is to make sure that you make the best aesthetic choices for yourself, that you have trust in us, and that you feel that we educate you to make best choices. I wanted to credential myself a little bit, though, again, to be a truth teller. So I found this picture of me. This was the day I graduated from medical school. And what really strikes me about it is I'm carrying a camera. This was 2001. This was before social media, before iPhones. I think it was pretty much before we had photos on any of our phones at all. So I graduated from medical school a long time ago. I've been in practice for quite some time. So from 2001 to 2002, I did a general surgery internship. This is no longer required for otolaryngology, which is ENT, but at the time I did spend an entire year doing general surgery and I had a 1 month plastics rotation during that year. I spent 4 years in an otolaryngology residency at Jefferson in Philadelphia. That's where I did general surgery, and that's where I went to medical school. I like to say that I was a Jeff lifer. Any of you out there who know Jefferson, I have great fondness for my experiences there. And something that people don't know, 25% of ENT boards reflect facial plastics. I did my fellowship at the University of Miami, and I stayed there. Now, this becomes a little important. We're going to come back to it. You might have heard this term SMAS lift, deep plane lift. We're going to come back to that. The original facelifts that were described in the 1970s and they were skin only, but doesn't work. Skin falls back down. So the next introduced was like late 70s, 80s was SMAS lifting. And that's what I was trained in, probably because I'm older than many of the surgeons out there. But I did eventually transition to deep plane, which we'll get to. I was on faculty at the University of Miami for 15 years, where I was a SMAS lift surgeon. And then when I started at the Mayo Clinic, which I finished working at this summer when I joined Clear Dermatology, I became a deep plane surgeon. So I retrained myself to do the most modern facelifting techniques. Here's a question that comes up nonstop. It's actually a little bit of a bugger of mine when people talk about lifting with fillers, lifting with energy. There is a hand raised, so maybe I can take a quick look at that. And then I'm going to ask my team here to help me take a quick look at the chat, and I might come back to questions. We're going to take a quick look. Well, I'll keep talking while the team is going to look for the chat. So if you did ask a question, don't worry, we're going to get back to it. So I consider lifting a holy grail. We don't actually have the ability to lift without surgery. That's why it's still a remaining holy grail, because we haven't found a way. So again, why is that? So I'm going to get a little technical here. This is a picture from a very famous paper by a colleague named Dr. Kodner. He's no longer with us, but great respect to his work. Do you see those white things? And they're all named these little ligaments. They go from bone to skin. If you do not release them, you cannot move the face. Period. The end. So that's what facelifting is able to do. Facelifting releases some of these ligaments and allows repositioning of the face. If you can imagine, fillers cannot release these, and neither can energy. Those energies, such as what we have at Clear Dermatology, would be, for instance, soft wave, which I love for smoothing and for maybe a tiny bit of skin tightening. But there's no such thing as moving elements of the face, and I'm going to show it on myself. This cannot happen without release of ligaments. So pardon for getting a little extra technical, but I wanted to clear up that myth for a moment. And the main ones, you may be able to see my little arrow here. We release these ligaments, the zygomatocutaneous ligaments and the mandibular cutaneous. The mandibular cutaneous ligament is the bugger that's creating jowling. And again, you cannot move your jowl without releasing it. So this is my best friend, Carrie. She may actually be watching this today. And it's just a reminder what I say, what people say to me, can you please do this with a syringe of filler? Now she's very, very beautiful and she does not need a lift at all. But again, this idea that a filler could pull and reposition your face is not possible. Again, we love fillers for, let's see, I need to keep moving. We love fillers for their use in contouring, changing light, filling lines. They're wonderful, but there's no lift possible. So I'm getting technical again here. This is one of my favorite papers by Dr. Cotofana, who's an anatomist, and colleagues who actually looked and did a quantitative analysis of lifting with soft tissue filler. Here's what they found. And to be clear, this was done in cadavers, so it's not a human. However, they used 3 syringes in their one side of the cadaver. They found that the temple lifted 0.78 millimeters, that the lateral midface, which is right here, either lifted or didn't lift, and the jawline changed 0.06 millimeters. This is with 3 syringes. I adore fillers. I'm not bad mouthing fillers. I think that I spent all day doing fillers. What I'm getting at here is the idea of lifting. And I actually think the jawline measurement is within the measurement of the analysis, like error of analysis. So please come see us for fillers. We love their ability to contour, to change shapes, to change the way the light hits your face. But in terms of lifting, the best way to consider changing the shape of your bottom of your face is with a facelift. This is another thing that comes up all the time. People really don't like the term facelift. They say, do I need a facelift? Can I have a mini lift? Can I have a lower facelift? Can I have a neck lift? Temporal lift, all these different things. So I just think this is all semantics. And I'm going to go through a little bit with you the incisions that are used for each of these to help you understand. Because what you can achieve with surgery all depends on surgeon access to the different parts of your face. So let's start. This is a picture of one of the wonderful people who work here at Clear who gave herself over to science and let me put marks on her face to show you facelift incisions. So hopefully you can see this arrow. I'm going to ask my team, can you see when I move this arrow? This is a facelift incision. So the first part of the facelift incision goes under the temporal tuft, which is right here. You can see in this patient, it's going right through the middle of the hairline. We try to avoid that if we possibly can, but we can't put an incision so far down on the face. So if you have hair right here, there's a chance that hair will come up. The incision then moves to the front of the ear, the back of the ear, and into the neckline. This is a quote unquote facelift incision. There's no other terminology for this, and this allows access to the nasolabial folds, the jawline, and the neck itself. Very important to understand. So regardless of what you want to call it, this is the access line for a facelift. Here we're showing it again, and you can see that I've made some marks in the hairline, which we'll come back to again. These incisions are hidden beautifully. They, on very rare occasion, can scar, but most of the time they're not visible, and people can go back to wearing um, ponytails or whatever, but this is the facelift incision, and that's why the semantics are not so important to me as what can be accessed again. With a facelift incision, you can access the entire part of your face here and your neck. Let's move on. Most of the time, there's also an incision under the chin. That allows for the center part of the neck to be accessed and for banding to be treated. So side incisions and under the chin, all incredibly well hidden, healed. If you want to see some of my incisions again and how they heal, please check out Instagram. But this is where they're placed, and this is why you can call it a lower facelift, you can call it a facelift, you can call it whatever you wish. What it really refers to is the incision lines. So there you can see the white line in her forehead. That would be a brow lift incision. I don't consider that part of a facelift, and not all people need incisions in their upper face. In order to access jawline and neck, the other incision that I showed you is absolutely necessary, but not everybody needs this, and that's very individual. So when we say facelift, sometimes people think that includes the upper face, and I do not believe that it does. And that is not what that term refers to. Let's now go back to this idea of different kind of facelifts. Again, there's lots of talk about, do I need a SMAS lift? Who's doing SMAS lifts? Who's doing deep plane? I personally, this is my philosophy, and I told you I spent the first part of my career performing SMAS lifts with great success. I do think that deep planes are better for outcome. So the different SMAS lifts work closer to the ear under the skin and try to pull the face from that location. That can be very effective. However, most surgeons will tell you that's the stickiest part of the face and the hardest to move. Deep planes enter the face a little more forward to what we consider the mobile area, and that allows more effective moving. It is working a little bit closer to the facial nerve, in particular, the one that controls your smile, but an experienced surgeon cannot make this zero, but can make the risk to your facial nerve almost zero and allow for better movement. Again, many people for many years have had success with different types of SMAS lifts. I have transitioned to the deep plane, and I do think it's more effective for moving the face and a better operation, but that doesn't mean that people are not doing a great job with SMAS lifts themselves. So people love this term mini or baby, like mini Botox or mini this, baby Botox. And so people are always like, I just want a mini. The problem with minis is you cannot access the neck. I'm not sure if it's showing up perfectly, but if you look on the far right of your screen, you can see a little white line that ends at the back of the ear. That is the only difference between a quote unquote mini facelift and a facelift, is the access points. And I'm going to go back to my original commentary that everything about the outcome depends on the surgeon access. This is not great access. So if you only want a tiny change to this part of your face, a mini might work. I do not offer mini facelifts because mini facelifts give mini results, and most people do not want a mini result. Most people who are trying to have a change to their face through a facelift want their neck to be treated as well. There's really no good access to the neck with a mini incision. So it's really the incision, again, that allows the access for the result. More ideas. What about having fillers ahead of facelifts? I really don't have a problem with that. Consensus will tell you that maybe anything that you start before a facelift should be about 6 months in advance. Stop doing other things to your face and discuss with your surgeon. The thing about this is, I don't think it's fair to tell people you can't do anything ever just because one day you might want a facelift. I get fillers to my face. I might want surgery one day. I told you I love fillers. I think that they are wonderful. However, you might want to talk to your surgeon about stopping 6 months in advance, just so there is no change to the way your face looks that might affect your facelift outcome. And possibly they could make going under the skin a little bit more difficult. But in general, they're a great marriage. And a lot of times you still need fillers for volume after facelifts. So don't give up on your fillers or think that facelift is the answer to everything. What about facelifts and Sculptra? This one also has some negativity surrounding it, which I really do not understand. First of all, reminder, Sculptra is not a filler. Sculptra is a collagen grower. It's basically a signaling molecule. It tells your own body to regenerate itself. It's very cool. It's one of my favorites. But one of the things that people get worried about is that for some reason they think Sculptra is going to make it more difficult to do a facelift. I'm not sure how more collagen in your skin would make it more difficult for a facelift. I'd like to also pause here and add for a second that different surgeons can have different opinions on lots of things, and we can still really respect each other's work. So maybe there is a favorite surgeon of yours who doesn't like Sculptra. Well, maybe that's something that you should consider. But there are plenty of surgeons out there, and a recent consensus paper done by multiple facial plastic surgeons and other general surgeons, plastic surgeons, talking about Sculptra. And the general consensus was stop 6 to 12 months in advance, but it is not a contraindication. I do not believe that, but I have great respect for my colleagues who might not want you to have had Sculptra. That is a discussion you need to have with your surgeon of choice. My opinion is that stopping 6 to 12 months in advance should be just fine. This is a no-no. I'm pretty sure most facelift surgeons out there will say, please do not have had threads within 5 years. Careful, I am not talking about what I think about threads. That is a completely different conversation, and it's beyond the scope of this chat. I'm saying the interplay between threads in a facelift is problematic for one very specific reason. The biggest risk, in my opinion, to a facelift is damage to the facial nerve, which is the nerve that controls all the muscles in your face on both sides. Guess what threads look like? Facial nerve. So what happens if there are threads left in the area of your face where your surgeon is trying to work? It can create confusion about, is that a nerve? And I've had this discussion with multiple wonderful facelift surgeons. It creates a lot of stress. And you do not want your surgeon to be stressed out because it decreases creativity. So most people will say no threads only because it looks like facial nerve. And that could be really deleterious to your final outcome. So I would say no threads with facelifts. Again, this is not a commentary on threads themselves. I'm not saying whether you should have threads or not. That's a discussion you would have to have with your aesthetic provider. I'm saying most facelift surgeons would tell you, please do not have had threads within 5 years of your facelift. What about facelifts and energy, such as Softwave, which we have here at Clear Dermatology or Althera? This is a little bit more controversial, I think, because it can create some people think that it can create thickening and scarring in that SMAS, the SMAS layer, and make it harder to move. I do not have a strong opinion on this, but some people do. I do think it's possible it could make moving that, again, what we want to do is release those ligaments, move the face back. It could make that movement a little more difficult. I want to give a shout out here to one of my favorite surgeons, Dr. Kian Karimi, who says, we are pilots and we can't only fly in good weather. So I think what his comment is, if you're a really good surgeon, you should be able to work around many of these things. I've said I do not care to work around threads. However, I would be willing to work around most of these other things that we're talking about. There also has been a fair bit of recent discussion about using general anesthesia or what we call local MAC, which is minimal sedation. Different surgeons will do different things. I use general anesthesia. All surgeons will use local anesthetic as well for control of bleeding and comfort. And many of us have started to use tranexamic acid to reduce the risk of a blood clot. Here's the thing about general anesthesia, in my opinion. We're going to go back to this facial nerve issue. If you have the ability to move at will and you have an involuntary response while you're under minimal sedation, while I am trying to work gently around your facial nerve, I think that is a problem. I have great respect after all these years of working around the facial nerve, both in residency as an otolaryngologist and then coming up on 20 years as a facial plastic surgeon. I really want my visualization of any nerve to be without anybody moving, just so I can avoid it. If people move, I could lose track of it or any of those things. General anesthesia under physician anesthesiologist direction is really quite safe. I always want a physician anesthesiologist to be in proximity of where I'm working. That's why I work in a surgery center with physician anesthesiologists. Again, this is very personal choice, something to discuss with your surgeon. I prefer physician anesthesiologist and general anesthesia for the reason that I just described. So now I'm going to come back to chats in a second and answer all your questions to the best of my ability. Just a reminder, I have beauty happy hours once a month. The next one is going to be January 16th from 4 to 6 p.m. You can save $150 on Dysport. And I want to tell you a little bit about Dysport pretty quickly. You see my little ornament. I'm a crafter and I made these like anti-aging ornaments. And inside is a little Dysport, Botox, there's a Daxxify. So these are all the neuromodulators that we have at Clear Dermatology. They all act very similarly, and they smooth wrinkles. We're gonna have a skincare raffle and bubbly and snacks. And it's from 4 to 6 only. One last thing about the webinar. If you book a consult to discuss with me by 2026, it's only $75 when usually it's $175 and comes with a deluxe medical grade skincare kit. I'd love to talk to you about your unique anatomy, your individual concerns, and what might be right for you anytime. So I look forward to talking to you. And now we're going to go into chat and take a quick look. So give me 1 second. So, do mini facelift and neck or smiles or deep techniques? What does the anesthesia look like? I think I answered the question. The initials of the person who asked this question are EB. If I haven't answered your question, please come out and say it again. I think I answered the question about the anesthesia and the different ways that I provide surgery and the different incisions. So if that question is still existing, please ask it again. Another question is, what if I had threads 2 to 3 years ago? I still think it probably would want to wash out a little bit longer, closer to 5. That is my feeling. There may be surgeons out there, and it also depends where the threads were. If the threads were in your neck or jawline, I'd be more concerned than if they were in your mid face or upper face. So that is a very individual question. For me, I'm pretty strict about the threads. Will you comment on the procedures required for fixing sagging eyelids? That is a great talk all unto itself. Happy to talk to this person, SW, in the office anytime, but I'm going to focus on facelifting here. And I did it should still be available. I gave a talk on this, I think it was 2 months ago, and all our webinars are taped and still available online. So please feel free to watch it and come in and chat with me about it. Oh, this is a great one. LB asked, what is average recovery time? So I've had mixed. Some people, I should also mention, I require everybody to stay overnight. The surgery center that I use has a very reasonable cash fee for overnight stays. That way, if there's anything that happens in the first 24 hours, you're right there in your surgery center and you get care. So sometimes when I come in to see patients day one and I unwrap them, they look amazing. Some people take longer. I would say on average, people are ready to go out at about 10 days. I think the swelling that comes from facelifting can be advantageous and look beautiful and give a glow. The bruising can persist a little bit longer. Although I have reduced my risk for bruising by using tranexamic acid, as I discussed before. So my bruising is more minimal these days as we've gotten more modern with our techniques. But I would say most people say average recovery time is 2 weeks. For the first week, I have people all day and all night in a compression device. There's also different surgeons do different things. I believe in compression. Some don't. And that doesn't mean that some great facelift surgeons don't believe in compression and they get great results. For me, I would like the skin to redrape and to adhere properly. So I require compression day and night for the first week, and then at night only for the second week. I do use drains. Again, some surgeons don't use drains. Drains do not prevent collection of blood. What they do prevent and help is get the skin to adhere properly once it's been released over the face. So drains come out between one day. More than 90% of people have drains out at one day, and some people have drains out at 3 days, but that's more rare. I'm looking to see if there's any other questions. Are there any other questions out there? Ah, blood thinners, no nos. People have to come off blood thinners to have a facelift. Another wonderful question. Most people need to have their doctor clear them and for anesthesia. So that's the first thing. This can become a little bit tricky. You have to ask yourself why, and I have to ask myself, why is my patient on a blood thinner? If it's because my patient has a risk of stroke, I don't think that I'd take them off the blood thinner for an elective cosmetic procedure, and that would have to be a very serious discussion. So remember, these are not necessary surgeries. These are elective surgeries. We don't want to cause long-term health damage, strokes, or other problems for the sake of a facelift, but it can be done with discussions. These are discussions with the person who prescribes your blood thinner. I'm always happy to have a discussion with my colleagues and see what the risk benefit is there. I will always lean towards minimizing risk to you, to your happiness, to your life for the sake of a facelift. Next question, do I have an office at Clear? I see patients at both offices, at both Paradise Valley and at the Bell office. But we do in-office smaller surgeries. Facelifting is done at a surgery center. Hyperbaric is a great question. Yes, actually, our next door neighbors have a hyperbaric. I think hyperbaric post-op is wonderful. We do not have a hyperbaric chamber in our office. I do think it helps. I think that the evidence is there, and there's an office next door with a hyperbaric. There is a fee for that, but that can be worked out, and I do recommend it. These are great questions. Anybody else have questions? So hyperbaric would be a dive the first couple days after. What is the cost range of a facelift? Another great question. Facelifts have become increasingly popular in the US and range. In our area, for a double board certified facial plastic surgeon, the range is 35 to 50,000 all included. I will add that throughout the US, these are very, very different. I have colleagues in California charging over 100,000, and I have colleagues in New York charging over 200,000. It just depends what your area can command. It also depends on what's being done and about how long. For instance, is there anything upper face being added? So average cost in our area for double board certification would be $35,000 to $50,000. Let's see. Any age limits? I love that's a great one. Age limits. I don't necessarily have an age limit. I have come to believe that there's a sweet spot for facelifts somewhere for everybody, but women in particular, somewhere between 50 and 55. This may have something to do with menopause and the way menopause changes the elasticity of your skin and how your face changes with menopause. The thing is, facelifts in people outside, let's call it the sweet spot. And it really is very individual. And sometimes it could be hard for me to predict. People in their early 50s, I think, and I hesitate to say this, but I'm going to go on a limb and say, if they have a facelift, they look younger. As you get older, you look better and you look refreshed, but it doesn't change your face back. And that has a lot to do with the skin. Don't forget, you have to take great care of your skin. This does not negate all the other things that we do at Clear Dermatology. That's the frosting on the cake. A beautiful, fluffy cake doesn't look nearly as wonderful or taste as good without frosting. There's still lots of upkeep. I think that spot is 50 to 55, 56, very individual. Um, a patient, somebody's asking 46. I'm not going to say no, but I'd have to see individually. Here's my hesitation in younger patients. It's not because I think you're going to need a revision. It's because I'm I'm taking apart parts of your face and moving them. And if you don't need to have that yet for your particular goal, I don't want to disrupt. Maybe we can do something different that will help you reach your goal that doesn't require the same downtime. It's all about your goals. My approach throughout my entire career has not been the only thing I do is surgery. I've tried to develop an expertise in all kinds of things: lasers, fillers, research, looking at next best things, because I want to reach people's goals. If the only thing that's going to make you happy at 46 is for your particular goal as a facelift, I'm very open to it. But if there are other things, I prefer to discuss more minimal first. I hope that answers your question, but I'm happy to discuss anything more at length in office. I'm going to ask my team, are there more questions that you see? Anybody else have more questions? Thank you so much for joining us. Happy holidays to everybody. Happy New Year, and I hope to see you soon. Bye.